I think most people are completely unaware of electromagnetic fields or EMFs. There's a variety of them, and you can't smell them or see them or taste them. So I think most people are completely unaware. My name's Reilly, and I'm from Lake Oswego. I started working with Clackamas County Fire District No. 1 in 2011. The thing that appealed most about being a firefighter for me was the teamwork and camaraderie aspect of it. You know, whether at the firehouse or out in the community helping citizens, you're with the same core group of people. They depend on you, you depend on them, and that was really appealing for me. The firefighting lifestyle, everybody was really big into paleo, and it was like the cure-all, the next great thing. And in that sphere, I picked up a little bit here and there about this concept of EMFs and how it tied into health. And the light bulb started to go on at that point. There was a scientist calling these things out for this type of invisible radiation that they produce and how it was related to negative health. The environment at the firehouse, it was just a soup of wireless EMF producing gadgets that you're surrounded by, cell phones, radios, pagers. You know, you're sleeping in a dorm room setting with multiple other firefighters. They've all got their cell phones and their pagers right beside their bed. You're just surrounded by man-made EMF. I left my career as a firefighter in 2014. I started experiencing insomnia, brain fog, and it became clear to me that there was something more in my environment that nutrition couldn't fix. And it had taken me a number of years to get to that point. So realizing that it wasn't working for my body and my family was very heartbreaking. Just a few years later, my mom was diagnosed with a very aggressive form of brain cancer called glioblastoma multiforme, and from time of diagnosis to the time of her passing was just about 8 months. After my mom passed, I was at her house. I had some basic meters, EMF meters at that point, and took some readings, and I was really shocked at how high the levels were in her home. And then I took it one step further and was just kind of remembering how she used technology, and cell phone on the nightstand and an iPad, you know, on her bed or under her pillow when she slept. She was always talking with the phone up to her ear, you know, no headset, no separation, no speakerphone. And it really solidified this picture for me that based on the research I had read at that point about EMFs and the levels, that this had been a huge player in her contracting this glioblastoma and ultimately passing from it. After losing my mom and previously losing my career, I did a little soul searching, and I wasn't really sure what I wanted to do next. But I did feel this drive underneath it all to help people, to avoid the misery that I had faced. And a simple Google search and Building Biology Institute came up, and I found out I could be certified as a building biologist or electromagnetic radiation specialist. And I could help people in their homes or offices or cars to identify what their EMF exposures are and help them reduce those things. And that was exactly what I wanted to do, although I didn't know it until I saw it. Building biology is the discipline that speaks to creating healthy homes, healthy living spaces, from air and water quality to building materials and electromagnetics. An electromagnetic field is just essentially the way the various forms energy travels throughout the universe. And in building biology, we would classify the four main types as light, radio frequency, all the wireless stuff, and then AC electric and magnetic, which have to do with wiring and power lines and the man-made electrical grid. common misconceptions about EMFs when I speak with my clients are that the government and industry standards are still relevant today and protective, which they're not. This concept of EMFs, wireless radiation, has been studied, well studied, going back over 100 years. And these are PhD researchers, epidemiologists, scientists, doctors, I mean, you name it. There are many, many bright people looking at this issue. And scientists who study radio frequency radiation have found dozens of health effects, from decreased sperm motility and fertility overall, disruption of the blood-brain barrier, cancers, diabetes, the list can go on and on. Electro-hypersensitive people commonly report a variety of ailments, from brain fog to ringing in the ears, distorted, disturbed vision, eczema, rashes, tingling in their extremities, many others. I never really gave cell phones, cell towers a second thought. I just assumed, I guess, that if they were there, it was okay, the government had done its due diligence. The RF standards and guidelines in this country are set by the FCC, and they have not updated those in decades. And this is a huge concern because when those guidelines were set, the cellular ecosystem, if you will, was so basic. And everything is so much more exponentially advanced today in the amount of energy and radiation that they're consuming and emitting. And it's all around us now. Kids are more vulnerable to radio frequency radiation for a couple of reasons that science has called out. First being that their brains don't become fully myelinated or shielded and insulated until their mid-20s, and their skulls are thinner as they're developing, so there's less of a barrier there. I have two daughters, 8 and 6, and they are currently attending Forest Hills Elementary. Lake Oswego Junior High has a cell tower on the property, and right across the street at the high school, there are 2 separate cell towers. The International Association of Firefighters condemns cell towers on fire station property due to the associated health risks. And it really begs the question, if it's not okay for firefighters, why should we accept that it's okay for our kids when they're at school? As a certified building biologist, my recommendation to Lake Oswego School District would be to absolutely not have cell towers on their properties. It is exposing the children to extremely unsafe levels of radio frequency radiation. I think the best way to approach this issue moving forward is just simple phone calls and emails to principal, school administrators, school boards, PTC clubs, just to tell them that this is resonating with you, that you're concerned about this, and that you'd like to start up a conversation, see where they stand on it.